Hello, my name is Molly Coughlin, and for my term project, I decided to research music therapy as a treatment of autism spectrum disorder. So the first thing I looked into was what is autism spectrum disorder. It's a neurodevelopmental disorder which is characterized by disabilities in brain functioning, and they typically emerge early in childhood and affect behavior, memory, concentration, and ability to learn. And autism itself is a disorder that's marked by extreme unresponsiveness to other people, communication deficits, highly rigid and repetitive behaviors, interests, and activities. And the symptoms for this appear really early in life, typically by age 3. It's extremely common. It's 1 in 50 children qualify for a diagnosis, and it's more commonly diagnosed in boys than it is in girls. So then I wanted to find out what are the causes of autism spectrum disorder. I found out that originally they thought that there were sociocultural causes like parenting, cold and aloof parenting, was the cause for it, but this was largely rejected by research. They found that there are more psychological causes, like a failure to develop a theory of mind, which is generally understanding that your thoughts and beliefs are different from what other people think and believe and understand, and a failure to develop joint attention. So that's just like when you're working on a task with another person, forming a connection with them, stuff like that. And these deficits are likely due to biological reasons, and the biological causes are there's a genetic factor. It also could be from prenatal difficulties or birth complications. There are cerebellum deficiencies and flawed interconnectivity of brain structures. So the brain structures don't communicate properly, and that causes a lot of these issues. The typical treatment for autism spectrum disorder is cognitive behavioral therapy, where they use modeling and operant conditioning to show and teach the children with autism spectrum disorder what are appropriate behaviors and how to implement them into their daily life. There's also communication training, so a lot of people who have autism are nonverbal, so they can use sign language or simultaneous communication, which is verbal communication combined with sign language. And there's also augmentative communication systems, which are basically just like communication boards, so people who have autism can point to different pictures and tell people what they mean. And then there's parent training, which is instruction for applying conditioning and skill building techniques at home. So these cognitive behavioral therapy techniques are taught to the parents so that the parents can apply them at home. And then community integration is just furthering this even further to school and home based programs so that it's in all aspects of their lives. So next I wanted to find out what is music therapy, and it's the clinical and evidence-based use of music interventions to accomplish individualized goals with a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. And I got this from the American Music Therapy Association website, just the definition. And there's a lot of goals for it, but the main goal for the treatment of autism is improving communication and social skills. And so how is it used to treat autism? It helps develop this joint attention and symbolic communication and a share of positive affect. And the main things that I was wondering when I was researching this is, does it actually help improve social skills? So this would be like the joint engagement and attention. And if there is an improvement in these skills, does it translate into real life social situations? Or is it just when they're in the therapy situation that these benefits occur? So I found some research on it. The first thing I found was about dyadic drum playing and social skills, and this had 2 studies. The first one compared dyadic drum playing with 42 typical children and 10 children who had autism spectrum disorder. So dyadic drum playing just means one-on-one with a music therapist. They were playing drums together, and dyadic was basically seeing if they had any joint attention, and they found that it is associated with social skills, so there was a strong correlation, and so they used the presence of dyadic drum playing as a measure of social skills for the second study, which introduced a rhythm-mediated intervention to 8 children who had autism spectrum disorder and measured changes in their social skills after the intervention. So they measured whether they were successfully playing dyadic drum playing before, during, and after the different sessions and interventions of music therapy, and they found a significant increase in social skills after several sessions of music therapy. Another piece of research I found was about the therapeutic relationship as a predictor of change in music therapy with young children. So there's 48 children who had autism spectrum disorder, and they had each a music therapist who was trained, and they were either in a high intensity or low intensity condition. So high intensity just meant that they met 3 times a week, and low intensity just meant that they met once a week instead of 3. And this study found that more than any other factor, the social development and development of social skills occurred when a therapist was attuned to the musical and emotional needs of communicating and relating that of the child. In both the low intensity and the high intensity condition, there was an improvement as long as this therapist was attuned to the child's needs. And then I found one other. This was a case study, so there was 3 children, and they took a baseline score of their social skill, several different measures of their social skills, and then they had several week-long intervention of music therapy. All of the children exhibited an increase in social skills after the music therapy, and it extended into their daily life. They actually did a follow-up where their teachers and their parents rated their behavior on this after the therapy had completed, and the follow-up showed that it extended into their daily life. And the data from Bill, which is one of the children, is pictured right here on the right. As you can see, the baseline score is pretty low, and then when the music therapy starts, it increases, and the follow-up shows that it stays increased. So my conclusions that I've drawn from this is that it's a great tool when used with other forms of therapy, cognitive behavioral therapy, communication training, and stuff like that. I wouldn't ever replace music therapy for the other forms of therapy, but it definitely shows an improvement in a lot of children. And social skills tend to improve for the children with autism spectrum disorder when they're engaged in this program. So like I said, it is effective when combined with other therapies. And in the case of any therapy program for children with autism, the therapist's attunement to emotional and communication style of the child is essential for improvement in their social skills. These are my references. Thank you for listening.